Ever walked out of a clinic after a perfect presentation, only to realize the doctor didn't commit to a single trial? You had the samples. You had the clinical data. You had the glossy visual aid. And yet, you left with a polite, "Send me the literature," which is pharma speak for "I'm not interested, but I'm too busy to argue." Sound familiar? Here's the contrarian truth that most medical representatives never figure out. The sale doesn't happen during the presentation. It happens before you even open your bag. If you're still relying on a rehearsed greet detailing clothes script, you're not selling, you're just reading aloud. And doctors can smell a script from a mile away. Today, I'm going to walk you through a 5-step framework that flips the traditional model on its head. By step 5, you won't be begging for a prescription. The doctor will be asking you for more information. Grab a notepad. This isn't theory. This is the blueprint you wish they'd taught you in training. Let's dive in. Let's get one thing straight right off the bat. Your call doesn't start when you walk into the clinic. It starts the night before. Most reps treat every doctor's clinic like it's the same cookie-cutter environment. They walk in, throw up a generic presentation, and pray for a hit. That's a losing strategy. The contrarian edge. You don't sell to a doctor. You sell to a patient population. First, know your doctor's patient profile. Are they a geriatric specialist? A pediatrician? A cardiologist managing chronic conditions? Your product's data means nothing unless it's tied to the specific patients they treat every single day. Second, set a single, measurable call objective. Never walk in with a vague goal like get them to prescribe. Instead, aim for a micro-commitment. Get the doctor to agree to a 2-week trial on 3 patients and secure a follow-up call. Third, prepare 3 curiosity questions. These aren't about your product. They're about the doctor's current challenges. Position yourself as a consultant, not a peddler. Write these down. Rehearse them. They are your most powerful weapon. The golden rule. Do not start with your product. Start with why you're there. You have roughly 60 seconds to establish trust. If you waste it on a fake "how are you" that you don't care about, you've already lost them. The contrarian twist. Ditch the phony pleasantries. Doctors see right through them. You earn respect by being direct and relevant. Here's the 3-part opening structure I use. Part 1, name plus company. Keep it brief. 5 seconds. They already know who you are. Part 2, the genuine observation. Notice something specific about their practice. I saw you're now open on Saturdays. That must really help your working patients. It's not flattery. It's showing you pay attention. Part 3, the value bridge. I came across a recent study that addresses exactly what we discussed last time. Do you have 2 minutes for a quick insight? Why this works? You're asking for permission, not demanding attention. You're putting the control in their hands. When they say yes, they are psychologically committed to listening. Here's where most reps cave. They've got 2 minutes of attention, so they rush to dump all the data they memorized last night. Stop. The more you talk, the less they buy. The 80-20 listening rule. You talk 20% of the time. They talk 80% of the time. Take notes. Real notes. When a doctor sees you jotting down their specific concerns, it signals one thing: respect. Use what I call the CHAMPS framework to guide this discovery phase. Challenges. What isn't working with their current standard of care? Health impact. How does that failure affect patient outcomes? Access. Are their patients struggling to afford current alternatives? Motivation. What would personally make them consider switching? Pathway. What's their actual process for trialing a new product? Here's a script snippet you can use. If I could show you a solution that specifically reduces those side effects you mentioned by 30%, would you be open to reviewing the data right now? Notice what just happened. You didn't pitch. You diagnosed. And then you asked for permission to prescribe a solution. All right, you've earned the right to present. Now, for the love of all that is holy, ditch the brochure. I don't care how glossy that visual aid is. Reading the PI sheet or reciting molecule weight puts your doctor to sleep. They have access to PubMed. They don't need you to read to them. The contrarian edge. Don't present data. Present a story. The case study technique. Doctors remember stories better than they remember statistics. Instead of, our clinical trial shows a 25% reduction in symptoms. Try this. Last month, I sat with a GP in Penang who had a patient exactly like yours. Same age, same profile, same complaints. After switching to product X, that patient reported a 30% reduction in symptoms within 2 weeks. The one chart rule. Pick one killer graph, the one that speaks directly to the challenge they just told you about in step 2. Use that. Put the rest away. The contrarian close. Before you flip the page, ask, I have the full clinical paper here. Would you trust me to walk you through the 3 key takeaways in 60 seconds? Again, you're asking permission. You're keeping them in control. This reduces resistance like nothing else. You knew it was coming. The objection. It's too expensive. I'm happy with what I'm using. Send me the literature. Most reps panic. They start defending, arguing, or worse, they pack up and leave. The contrarian reality. An objection is not a rejection. It's a question disguised as a statement. Don't defend. Explore. When they say, too expensive, don't say, but it's cost-effective. Instead, say, that's a fair point. Tell me, how are you currently managing costs for your patients in that bracket? You're probing for the real concern. The feel, felt, found method with a twist. I understand why you'd feel that way. Validation. Other doctors in your specialty felt the same way at first. Social proof. What they found was that the higher upfront cost actually reduced total treatment costs by cutting down on follow-up visits. The pivot. Prep for the top 3 objections. I'm happy with what I'm using. Probe for unmet needs. Send me the literature. Highlight the 2 pages that matter most. I don't have time. Ask, is there a specific patient profile you'd consider trialing this on if the data supports it? Always leave them with a decision, not a brochure. This is the final step, and it's where the money is made. The contrarian reality. Doctors hate being pushed, but they love discovery. So, don't ask for the order. Ask for the experiment. Ask for a trial, not a prescription. Would you be open to starting just 2 of your newly diagnosed patients on a 2-week sample course? I'll come back next Thursday to hear your feedback. See what happened there? You got the commitment and the follow-up appointment in the same sentence. Secure the next call before you leave. This is the single most overlooked step in medical sales. Book it while you're still in the consultation room. Great. I'll prepare the adherence profiles for those 2 patients. I'll swing by at 10 a.m. next Thursday. Does that work for you? The leave behind that actually gets read. Don't leave a novel. Leave a 1-page cheat sheet. Plain English. No dense medical jargon. And put your QR code on it, linking to a full video detailing on your website. They won't read the novel, but they will scan that cheat sheet when you're gone. Let's recap the 5 steps, plus step 0, that turn a cold call into a committed trial. Step 0. Prepare with curiosity questions and a patient-focused strategy. Step 1. Open with value, not fluff. Step 2. Diagnose the need before you present the data. Step 3. Bridge the evidence using a story, not a spreadsheet. Step 4. Handshake objections by exploring, not defending. Step 5. Close with a micro-commitment and lock in the next visit. Remember this, the best medical reps don't sell drugs. They solve problems. If you shift your mindset from detailing to diagnosing, you'll never have to chase a prescription again. It will chase you. Ready to flip the script on your next visit? Question for you. What's your biggest struggle during that 2-minute detailing window? Drop it in the comments below. I read every single one, and I might just feature your challenge in my next video. Thanks for watching. Now go out there and get that yes. Subscribe for more pharma sales strategies that actually work. See you in the next one.